Hello, my name is Tina, and I'm one of the many registered nurses we have at Infusion Therapy waiting to care for you. Thanks for making time to watch this video, and thanks for choosing Enloe for your oncology care. This short video is to help you better understand the anti-cancer medications you might receive during your treatment. We realize there is a lot of information to absorb when you receive a diagnosis and are starting treatment. That is why we ask you to watch these videos. Sometimes you need to hear things more than once for them to sink in. It's also helpful to have other family members who are assisting with your care watch these videos. They may not have the opportunity to hear the education that you get from the nurses, so this is their chance to learn what is going on. You don't have to worry about writing everything down. The information in this video is also in your patient guide. Look in the back of your patient guide to find additional information about dealing with side effects and things that you can do to feel better. You will also receive additional education specific to your type of treatment from your nurse. You can keep those handouts in your patient guide for easy access. I do encourage you to write down any questions that you have. You can call your nurse or ask your questions the next time you have an appointment. Remember, you can pause this video at any time. Cancer treatments are many. They include surgery, radiation oncology, and medical oncology. Your medical oncologist uses anti-cancer medications to treat your cancer. Due to amazing advances in cancer treatment, the kinds of cancer-fighting medications and the ways they are administered are always changing. There are hundreds of cancer-fighting medications. All of these different treatments can be confusing to patients and families. This video will talk about some of the most common types of anti-cancer medications and how they are administered so that you have a better understanding of your cancer treatment. Our body is made up of cells. When something goes wrong in a healthy cell, it will stop dividing and making more cells because it's not working right. But cancer cells keep on dividing and making more cancer cells, even though the cell is broken. Chemotherapy is medication that destroys cancer cells so they can't keep growing. It stops the cancer cells from dividing to make more cells. Because cancer cells usually grow and divide at a faster rate than healthy cells, chemotherapy destroys the cancer cells more quickly than it destroys most healthy cells. However, chemotherapy medications are powerful. They cause damage to many growing cells, including some healthy cells. When the healthy cells are affected by the chemotherapy, then the patient experiences side effects of the treatment. Fortunately, there are medications and things that you can do to minimize side effects. You can learn more about chemotherapy and how to manage side effects in the Chemotherapy and You booklet provided in the back of your patient guide binder, and by watching the recommended chemotherapy basics video at chemocare.com. Immunotherapy medications stimulate or suppress the immune system to help the body fight cancer. They don't work for every type of cancer, and they don't work for every patient. It is very specific. You will get detailed education about your immunotherapy medication from your nurse. Some of the side effects of immunotherapy are similar to regular chemotherapy, but the way that we treat those side effects is different. If you are unclear about whether you are receiving immunotherapy or chemotherapy or both, please ask your nurse. And if you want a more technical explanation of how immunotherapy works, you can watch the 3.5-minute video about immunotherapy from the National Cancer Institute by pausing this video and going to the link given here. Targeted therapy medications work by interfering with specific proteins that control how cancer cells grow, divide, and spread. Most targeted therapies are monoclonal antibodies. If you are prescribed a targeted therapy, you will get specific education about your medication from your nurse. And you can learn more about targeted therapies from watching the short videos available at chemocare.com and the National Cancer Institute. Hormone therapy can work in two different ways. Some treatments block the body's ability to produce certain hormones, and other types of hormone therapy interfere with how hormones behave in the body. If you are receiving a hormone therapy, your nurse may ask you to watch the hormone therapy video on chemocare.com. There are also different ways that anti-cancer medications are administered to your body. Your anti-cancer medication may be put into your veins in our infusion clinic. You might be prescribed anti-cancer medications that you take in the form of a pill. Lastly, you might receive your anti-cancer medication in the form of a shot or injection. These injections are administered by our shot clinic here at the Cancer Center. Oral anti-cancer medications are not like other pills you take. Your nurse will direct you to videos to watch and will give you handouts that will provide all the information you need to take these medications safely. It is important to follow the instructions carefully. Most oral anti-cancer medications come from a specialty pharmacy, and they will be delivered directly to your house. Don't wait till the last minute to reorder your medications. At least 2 to 3 business days minimum are needed to process a refill for specialty medications, and you don't want to miss a dose. So staying on top of refills is an important part of oral medication treatment. Be aware that the specialty pharmacy will always call to confirm your shipment. If you use a cell phone, it will show up as an 800 number, but don't block it. You might want to enter the name of the pharmacy with that number as a contact, so that you know to pick up the phone when they call you. You might be wondering, how does the oncologist decide what medications to use for my cancer? Doctors follow certain guidelines when planning treatment doses and combinations of treatments. These guidelines are based on research studies that are specific for the type and stage of cancer you have. They also look at special test results like blood tests, bone marrow biopsies, tumor markers, biomarkers, and genetic testing to determine what treatment is best. For example, not all breast cancers are the same. So 2 people can have breast cancer, but their breast cancer can be different, so their treatment plans will be different. Planning a treatment has become very specialized. Your treatment may include just one type of medication or more than one type of medication. Or it may include medications that are given different routes. For example, you might be taking an oral medication and coming to infusion therapy to get an IV medication. Your oncologist and the rest of your cancer team is going to monitor how the plan is working and may change the plan if there are ways to make it work better for you. Lastly, we want to remind you that you are the ultimate decision maker. The members of your healthcare team are your crew. We provide information and advice, but you are the captain, and ultimately you choose what you want or do not want in terms of treatment. We support your decision. If you have concerns or questions about your treatment plan or treatment schedule, be sure to communicate those to the team. There might be other options for you. In your patient guide, you will find this checklist of what to do to prepare for treatment. A few highlights include making sure that you have a primary care physician to address your non-cancer related medical concerns. If you do not have a primary care physician, please get one as soon as possible. Your oncology doctor does not treat non-cancer related medical needs. You will need a primary care physician to manage your care after your treatment also. So it's good to have that person on board now. Enloe does offer Find a Physician at www.enloe.org. And if you need help, you can ask for assistance at the Cancer Center Library. It's a good idea to call your dentist and let them know that you're starting treatment. We know it can be hard to get in, but if you let your dentist know that you are starting chemotherapy, they will often make an appointment for you. There are things that they can do during treatment: gentle cleaning of your teeth, fluoride treatments to prevent decay. but they will avoid doing anything that might cause bleeding or lead to infection. Make sure you sign up for Brighter Days, Bright Smiles, which is a program we offer here at the Cancer Center. You meet with a dermatologist and a dental hygienist that offer lots of tips for how to care with your skin and your teeth while you're undergoing treatment. Anti-cancer treatment might affect your ability to get pregnant and have a baby. Make sure you ask questions about this at your oncology appointment with your doctor or nurse practitioner. They have information for you about fertility options for patients. We do want you to get a digital thermometer. It's important that you are able to take your temperature at home. For the first couple of treatments, make sure someone else is driving you here and back home. After you know how you tolerate your treatments, you may be able to drive yourself. Make sure that you get your prescription medications filled and picked up. And if you're supposed to start taking them the day before your treatment, make sure that you take them as directed. And as always, make a list of your questions or concerns. We're happy to answer your questions. There is a possibility that during your treatment, you will experience symptoms that need immediate attention. We want to tell you now the best way to proceed if this happens, so that you won't be trying to figure out what to do when you're not feeling well. If you have any of the symptoms listed on the important instructions sheet that is in your patient guide, call your doctor's office immediately. The earlier you call us, the more likely it is that we can help you without sending you to the emergency department. After office hours, you should immediately go to the emergency department, and they will contact the doctor if they have questions. Sometimes people wake up not feeling well, but they wait all day long, hoping that they will feel better. And then they call right at the end of the day, hoping to talk to their oncology doctor. Unfortunately, this leaves the healthcare team very little time to try to get you in to be seen, and you may end up being sent to the emergency department. So don't wait till the end of the day to call. Try to get your concerns addressed early in the day. Sometimes people will think, well, I have a treatment tomorrow, so I'll just talk to someone about my symptoms when I get there. Unfortunately, when you wait until the day of treatment, it doesn't give the team time to resolve your issues, and it can delay your treatment. It would be better to call earlier so that we can try to resolve any issues before your scheduled appointment time. These important instructions listed on this sheet are in the very front of your binder, and we encourage them to put them in a place where it will be easy for you to find them. We know people don't like to go to the emergency department, but sometimes it is necessary. Unfortunately, emergency rooms are usually full of sick people. When we ask you to go to the emergency department, we need you to take steps to keep yourself from being exposed to others that are sick. So when you arrive, inform the emergency department staff that you are a cancer patient undergoing treatment. If they can get you to a bed directly, they will. Or if they can put you in an area where there's not as many people, they will. But if they cannot get you back immediately, you can give them your cell phone number and wait with your caregiver in your car, and they will call you. Lastly, if the doctor or nurse tells you to go to the emergency department, they do not do it lightly. They send you to the emergency department because you can be seen quickly there. If you are asked to go to the emergency department, please go. You will be scheduled for regular lab draws during your cancer treatment. By looking at your lab results, the team can determine if your blood counts are in the right range for you to receive treatment. You might also be scheduled for labs before an appointment with your oncologist or advanced practice provider. For your convenience, we have a drive-through draw station, which means you don't even have to find a parking space. Even if you have a port in place, your blood work will be drawn from your arm. This is because ports are only accessed by a trained nurse and not by our lab staff. Please get your labs done the day before your chemo treatment or doctor's appointment. But if coming in the day before is a hardship for you, for example, you live several hours away from Enloe, then please talk to your doctor's nurse to see if other arrangements can be made. You will be surprised by how quickly you can see your labs if you are registered for MyChart, the Enloe patient portal. If you need help getting into your portal, you can ask for help at the Cancer Center library. You can also ask your nurse for a printed copy of your labs, or you can ask your nurse to write your blood counts in your personal organizer. Some patients really like to keep track of their labs, and others just really want to know if the treatment will happen or not. You get to choose. This is what your complete blood count, or CBC, lab report looks like in MyChart. Pre-chemotherapy blood work lets us know that your blood counts are in a safe range for you to receive treatment. There is a lot of information to read on this page. When the nurses look at these results, we are basically looking at three things: the red blood cells, the white blood cells, and the platelets. Your red blood cells carry oxygen from your lungs to the rest of your body. When your red blood cells are low, you might feel more fatigue and shortness of breath. Your white blood cells are your infection-fighting cells. There are several types of white blood cells. The specific white blood cell that we look at is the neutrophil count. Your neutrophils are your white blood cells that are ready to activate if you are exposed to an infection. When those become low, you are at higher risk of getting an infection. Your platelets are your cells that stop bleeding. When your platelets are very low, your body is more at risk for not being able to stop a bleed, either external, like a cut to your skin, or internal, like a bruise under your skin. Remember, your blood cells are fast-growing cells, and it is expected and normal that all of these results would become low while a person is receiving chemotherapy treatment. There are different precautions we ask patients to take depending on if they are low on their red blood cells, their white blood cells, or their platelets. Your doctor might also order a comprehensive metabolic panel, or a CMP, which measures how much glucose, sodium, potassium, chloride, etc. are in your blood. Checking to see that these things are in a normal range is a way to be sure that your vital organs like your liver and your kidneys are handling your treatment well. Also, there are additional blood tests that might be ordered that are even more specific to your diagnosis and treatment plan. If you need to get these additional tests, your nurse will explain why. Getting a cancer diagnosis and starting treatment is understandably overwhelming, but there are things that you can do to feel more in control. Read through the drug information and schedule provided by your nurse. Watch the patient education videos that are suggested and share the videos with other people involved in your care so that everyone is on the same page. It's easier to absorb information while watching the videos in the comfort of your own home than when you are sitting at the cancer center getting treatment. The videos will help you be better prepared to deal with possible side effects. You'll know what you need to do if you need to go to the hospital, and you'll learn things that you can do to feel better so that you and your caregivers are having the best possible experience during your treatment. After reviewing the materials, if you still have any questions about your type of cancer drug or about how it will be administered, just call your doctor's nurse. Sometimes patients say they feel guilty about calling or they apologize for calling, but don't worry about that because this is our job. Most patients find that once treatment begins, things get easier. The anxiety that is a natural response to uncertainty and the unknown usually settles after you get through your first treatment and you see how it goes. Then you kind of know what to expect. You become more confident and comfortable with your treatment plan. We know that starting cancer treatment is a big deal. We want you to know that we're here for you, we're cheering for you, we're going to help you make it through. Thanks for watching, and thanks for letting us be part of your oncology care team.